if we can see the beauty in our friends and our family and other people, if we're telling them, wow, you're a really great friend, you're a really great mom, like, why can't we tell ourselves that we're great?
Oh, I gotta go. I've been working, told them please don't hit my phone. I'm in my zone, bruh, just leave me alone. Was on the road, but I swear I'm coming home. Now the drinks on me, I think we need a toast. See, I did it for me. Now my old friends calling, told them nothing's for free. Told me time is money, dog, swear I paid all my fees. I was starving for this game, now my family can eat.
Hey everyone, welcome to the Couple Nurses Show with your hosts, Peter and Matt, two nurses on a mission to change this world, one conversation at a time. If you find value on this show and want to join us on this mission, it would mean absolutely everything to us if you please share and review the show. CoupleNurses.com for the latest info, updates, and all the merch releases. For our lifestyle podcast, you can check out WeAreFrontlineWarriors.com.
In this episode, we would like to introduce you to Stephanie Polizzi. Stephanie is a licensed mental health counselor working at Peaceful Living Mental Health Counseling in Westchester County, New York. Stephanie specializes in working with teens and adults struggling with eating disorders, anxiety, trauma, behavioral challenges, and life transitions. Stephanie is a trained eye movement, desensitization, and reprocessing therapist at a trauma-informed practice. She uses a combination of EMDR, cognitive behavioral therapies, and other modalities when working with clients. Stephanie, thank you so much for being here. Can you give us a little background about yourself and how you got into therapy?
Yeah, so I'm raised in Westchester County, New York, where I'm currently practicing at Peaceful Living Mental Health Counseling. I grew up with my parents and two older brothers in a huge Italian family, big, loud Italian family. And I honestly went to therapy when I was in high school. I had lost my grandmother when I was 15, and that was just a really difficult thing for me to process. So I had reached out to my school social worker who had kind of introduced me to the therapist that I started working with, and my parents were really supportive of that decision. And I just sort of realized, like, wait a minute, this thing actually kind of works. And that kind of started the journey and like curiosity for me. It didn't totally just leap into like, oh, I want to be a therapist. But I went to undergrad at Widener University out in Pennsylvania, kind of toyed around a little bit and then landed on psychology of just like, hey, this makes sense. So that was kind of it. And then I got my master's at Baruch in the city. But I just sort of realized how much therapy was helping me and how much I wanted to help other people. So it kind of just all clicked.
So what did therapy allow you to do? Was just you needed some kind of a open space to talk about your feelings, or what did therapy provide for you that you were looking for when you were younger?
Yeah, I didn't really understand what was going on in my head. Like I lost my grandma and I didn't start to put all the pieces together until I went to therapy, until I started to really be like, wait a minute, something's not matching up. Like I started to be really angry and I like wasn't an angry person, but I didn't know how to express any of that anger. So therapy at the time was a space for me to explore that, but also be, and it wasn't necessarily that I didn't want to talk to my parents or didn't want to talk to my family members. It was really just like, I need my own person that I can just talk to that isn't going to kind of insert some of their own stuff or isn't going to look at me kind of funny if they heard what was going on in my head. And my therapist really provided that for me and just provided me the space and also understanding of what grief looked like. Because we don't really get taught that. It's just kind of like somebody dies. Now you're going to grieve. And it's like, what does that even look like? What do you mean? So she really helped me understand that like what I was doing was grieving, and it just didn't look like anybody else in my family. So yeah, she helped a lot. I'm very grateful.
That's what's fascinating is we don't have an instructions manual for our mind. So as a
Mhm.
therapist, they're telling you, hey, this is the phase that you're on. Your feelings and emotions are related to this. So you can start processing it and seeing what are the next steps that you can take to feel better.
Yeah, exactly.
And
Exactly.
in your current field, what are some challenging behaviors that your patients are dealing with that you're guiding them through?
Yeah, so I right now mostly work with teens and adults that are struggling with eating disorders, um, trauma. I'm also a trauma informed therapist. I'm an EMDR trained therapist, and I do work with some little guys. A lot of my like younger kids, I call them my little nuggets. A lot of them are coming just for kind of general understanding of what feelings look like. And a lot of parents, I think now with these kids, like this generation, are really starting to put those pieces together. They're like, oh, we don't have a manual. And people are starting to realize that when they were kids, they weren't taught how to handle their feelings or express their feelings, appropriately and accurately. So that's a lot of what like my younger kids are coming from. And then for my teens and my adults, it is mostly eating disorders, and we saw a big spike of that because of COVID. Um, so just trying to have them understand the messiness of what an eating disorder is and provide a lot of education around what an eating disorder is and what it can look like for certain people. So right now it's talking a lot of like restriction and binging and purging and kind of just trying to help people understand what's going on for them and kind of help with that roadmap a little bit.
I would love to understand eating disorders and why people struggle with them. But first, I want to understand, what is EMDR? What is the therapy that you actually provide to your patients?
Yeah. So EMDR is eye movement desensitization and reprocessing therapy. A bit of a mouthful. So I'm very happy that they shortened it to EMDR because I couldn't imagine saying that all the time. Um, so it's a type of trauma therapy that was originally developed in the 70s or 80s. I'm going to be annoyed at myself for not remembering that in a little bit, but was originally kind of developed for vets with PTSD, to process what happened overseas and in war, and it thankfully has shifted to a lot of different things, and it's not just for PTSD anymore, although it 100% still treats PTSD, but it's also used for depression and anxiety. I've used it with my eating disorder clients before. I've actually just this past summer did an entire training on EMDR and eating disorders. So it's not the only thing that I do, but it's one of the things that I do, that just helps people understand and process kind of what happened to them and how it turned into maybe these symptoms, these behaviors, these thoughts, and it helps process. And the beautiful thing about EMDR is it channels both cognitive and physical, because trauma is not only cognitive, trauma is what happens to our bodies as well. So it helps process any kind of unresolved feelings, anything that has gotten stuck, because our bodies remember all of that. Our bodies remember how they reacted in certain traumatic events. So EMDR isn't just talking your way out of something, but it's also feeling your way through the trauma, if that makes sense.
That's
Yeah.
powerful because the body keeps a score, right? So we have to,
Yep.
a lot of people think the mind is just up here, but the mind is the whole entire body itself. And we have to
Mhm.
integrate both parts because they're both independent organisms and of intelligence.
Yeah, and you hit the nail on the head, like, trying to like, we say the body keeps a score 100 times a week here, and, having people understand what that means and that trauma is stored in your body, and the reason that maybe other traditional therapies haven't worked for people is because they weren't getting to those physical pieces. Um, and EMDR can be used like as somebody's kind of first method of treatment. I think um, it's getting a lot more popular. EMDR. I'm hearing a lot more about it. We're having people call in and ask a lot more questions about EMDR. I think a lot of the times some people heard about it after they started some other type of treatment. Um, I'm saying a lot. I'm sorry, but it can definitely be used as its own modality and also in conjunction with other therapies, which is a lot of what I do. is kind of start, especially like my teenagers, start them with maybe CBT and other coping tools, and then kind of gradually shift them into EMDR therapy.
And how does a EMDR therapy look like? Is it a session where they sit down and it's with eye movement? So are they looking in specific directions? Are they looking at specific ways? And you're talking to them through it, or are you asking questions? How does that actually sit down a session look like?
So it's very different than your traditional talk therapy. There's actually not a lot of talking. So the way that we mimic the eye movements, and why eye movements or bilateral stimulation is so important, because research show that it's actually what we do during REM sleep, and how we process the day is by the bilateral stimulation. So what happens when something traumatic happens is that process can't happen and things get stuck. So if we're virtual for EMDR, we usually like we'll shift out of the way and have people follow our fingers from one side of the screen to the other. There's also all these fancy equipments. We have a light bar that in either in office or on the computer, we have people follow the light. There's also tactile. So we, again, if we're virtual, we'll have people we'll have cross their hands over their chest, which is called a butterfly hug, and have them tap. They can even tap their feet. And then there's also another chance of doing things auditory. So it kind of just goes like one ear, one ear, one ear, one ear. So that all of that bilateral stimulation is what's helping process the memory. And we're having them do that for a certain amount of sets, asking them what are they noticing, whether in their body or mentally, and then having them just keep doing those sets until kind of everything's either processed from the body, the cognitions around the trauma are changing for them. So it's very different than talking all the way through it, because a lot of the times we just don't talk at all, which can sometimes be difficult and like jarring for people because they're used to talking. And then we kind of have to be like, no, 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 hold on. A little bit less talking, a little bit more feeling, because we want them to still stay in their bodies and be able to notice what is being released.
So with this eye movement, it helps them. I don't want to say relive, but it helps them focus on that memory, or is that memory come back to them like in a better way? How does that eye movement actually like open up these like neural pathways to help them like remember this or process through this?
And
So we, yeah.
before you answer, I'm gonna take a spin at it too, because I'm thinking about it. Very fascinating, by the way. I feel like when they're doing all these tapping, and they are almost putting our like primitive mind into a hypnosis where you're focusing on the movement. So your mind is busy with the movement, and you're able to feel your body, because so many times we're using our mind to experience reality, but we're not using our body to experience reality. That's just
But
my.
then how does that differ from somebody just say meditating? Because you're not asking any kind of question. It's just like, how does that differ? How does that differ? Because in my mind, I see this as just a person sitting alone and processing through these memories. Just thinking about it is given the greater help than like the eye movement. How does the actual eye movement actually help facilitate this kind of you say therapy or
Yeah.
healing?
So
Good
we,
question.
yeah. So we have them start with what's called a target memory. So in terms of an entire treatment plan, we kind of start with we start with something in the present and have them do what's called a float back, which something in the present, we have them tap into an image, we have them tap into any other felt sense. And what we try to guide them through in a float back is allowing their mind to float to another point in time where they might have felt like that. So if it's anxiety or panic, and like they have all of these symptoms in their body, right? They have like their stomach starts to flutter, they feel tense, they start sweating. More often than not, there's something in their past that has elicited that same experience, and that's where those neural pathways come in of like there's things that link up for a reason. And so we'll pick somewhere to start. And we, again, kind of ask them, have a memory, have some feelings, and we ask them to have a thought, like a positive thought. And then we also ask them to have a negative thought, sorry, and then also ask them to have a positive thought. And there's a rating scale of how disturbing this memory is. And we want that to reduce. So the highest is 10 and the lowest is 0. And while they're focusing on that image and they start to tap or they start to look at the eye movements, it all depends on preference for the client. It's not so much it we have to task them to do two things at once of like paying attention to the eye movement, but not too much, and pay attention to what's going on cognitively and physically so that they kind of all go together at the same time. And that bilateral stimulation is what's helping process all those physical symptoms. And it's honestly magic. I'm stunned every time I do it with somebody because the way that the brain works and the way that one image is able to have somebody jump to something else and make those connections of, oh, this is why I felt like this. This is why I had that reaction. And almost be able to understand for themselves just, oh, now I can think this way instead. This way makes so much more sense. So it they just kind of sit and I know it sounds kind of weird that they're like sitting by themselves and kind of just tapping a little bit and then that's what's working, but it's just how all of those neural pathways are connected and what ends up being released for people, whether it's physical. I've had people start kind of crying in sessions. I've had people start kind of fidgeting a little bit and getting a little bit more comfortable. I even had somebody who's like actually like sinuses started to open up in session and he was like wiping his nose by the end, just because things are being released in the way that they were sort of supposed to, but what ended up being disrupted because of the trauma.
Fascinating. So you're just helping the person's body release the suppressed memory, the
Mm-hmm.
storage of energy that reduces the blockage. So the goal with this therapy is for them to realize their trigger, correct, and to make peace with it, or to see other aspects of reality of how to go about that memory or their thought or the emotion that kept creating that same experience, right?
Yeah, and each client kind of comes for different things too. So helping identify triggers is huge. And a lot of the kind of thought component that goes into EMDR is these kind of negative cognitions of it's my fault or I should have done something or even like why did this happen to me? I'm a bad person, kind of all of these things and then realizing, oh wait, none of this was my fault or this like yes this happened to me but I didn't cause this. I'm not a bad person, because that's what our brain ends up telling us in terms of like trying to survive. We're trying to make sense of the traumatic thing that happened and we more often than not automatically start to blame ourselves. So I must have done something to have xyz happen. And with EMDR processing, we're able to process sort of those unresolved feelings, those physical feelings that are trapped, and get to a better place and be able to say, wait a minute, how could I have caused this thing? That doesn't make sense.
Yeah, it's very interesting. Um, I'm really curious on how you got involved in working with people that had eating disorders, anxieties, and other challenging behaviors. What made you go down that route versus other you could say psych issues, if you want to call
Mhm.
them psych issues, or just issues in general.
Yeah. So I was in a sorority in college, and our philanthropy was the Association for Anorexia Nervosa and Associated Disorders. So we one week, I believe it was in the spring semester, it was called ANAD week, and we were raising money and had fundraisers. And we actually had somebody from my student health center, one of the therapists, talk about eating disorders in the college population. And as I'm sitting there listening to this presentation, I quite honestly had a light bulb moment of like, wow, all of this stuff really makes sense. And I want to know more about it. And I tried to get an internship at an eating disorder facility when I was in undergrad, but timing of things just didn't work out, but it just never left. So even when I went to grad school, it was something that I was asking professors about and trying to find internships for. Um, it's I don't have much other than it was just something that made sense to me. So after grad school, I got a job at a residential eating disorder facility. And that's just honestly where I started to learn, and from the ground up, basically, of what does an eating disorder look like, where, like, why are eating disorders triggered, and how to help. And I was there for a few years before taking the leap and kind of moving to private practice. So that was huge. I went from residential to outpatient, so that was a little bit jarring, but it was something that not a lot of people understand. So I was almost happy to be one of the people that did understand, and then able to take it and make a career out of it and be able to help people and help their families also understand what was going on.
And Stephanie, can you help us understand why people have this behavior of eating disorders? Is there a theme, a root cause issue that causes this trigger for people to binge on food?
Yeah, so there's not one specific cause to an eating disorder. Sometimes there's a genetic component, like just like that genetic predisposition. Sometimes it can be trauma. So if we, kind of look at COVID, it spiked so much because our whole world got turned upside down, and people were trying to figure out ways to cope with all of the unknowns. There could have also been some type of childhood trauma. The biggest thing, I guess, like the most cohesive way that I can explain an eating disorder is it's a coping tool. So there's that control piece of, I'm not able to control other things, so I'm going to control my food. I know that I can control if I eat this, when I eat this, what I cut out, and what I do after. And there's body image that goes into it, and like societally, that's a huge factor. How people view body image and the comments that get made about bodies, but also the comments that get made about food and how we're taught about food. So all of that kind of just squeezes all together, and more often than not, trying to identify what the purpose of an eating disorder is my main goal in like the first few sessions with a client, because it does serve a purpose. It's not just this thing that somebody chose one day, that nobody wakes up and is like, gonna have an eating disorder today. It's really something that develops over time, and it's what helps people cope when they're really struggling with something that they're not able to really get in touch with all the way.
Yeah. And is that the same when you're considering adults and teenagers? Are like, for example, when it comes to anxiety, eating disorders, or even challenging behaviors, are they suffering through the same things? For example, are these people have anxiety because of like a self-esteem issue, and that's true for teens and true for adults? Or is the reason why they have this eating disorder different between teens and adults? Like, is a teen
Mhm,
more focused on a physical weight issue versus
mhm.
a adult is maybe like a trigger issue? Or are they kind of the same when you take into consideration teenagers and adults?
Mhm. Yeah, a lot of the things end up overlapping for sure. I think timing of when an eating disorder started is huge too. Um, I also look at, like, I use the terms disordered eating and eating disorder, because sometimes, and, like, not many people, believe it or not, have a good relationship with food. There's always kind of something lingering that, well, I can't eat this because of this reason, and it could be like a weight gain type of thing. But a lot of the times, like, I'm kind of talking about the main themes of a trauma, of body image, of self-esteem, sort of that idea of like not feeling good enough. Um, and a lot of people, unfortunately, do think that being smaller will help them overcome all of those, which is a thing that and then ends up reinforcing an eating disorder. Society reinforces eating disorders all the time without really knowing it either, just the way that we do talk about people's bodies. Um, but teen or adult, they somehow end up kind of overlapping with what the themes are. And it's sometimes just how long somebody's had an eating disorder. A lot of my adults, like I'm ending up seeing after having been struggling for a really long time. So the dropping down to the teenage years for me was like, okay, maybe there's a way I can stop this before it gets somewhere else.
How does the healing process look for somebody that has an eating disorder? So I know that we mentioned CBT and EMDR. Are we going directly to the root cause of why they're coping by eating, or are we acknowledging first and creating self-awareness in patients and saying, hey, this is the wrong way to cope.
Mm-hmm.
Let's cope differently, and then let's get to the root cause. What's the, I don't want to say systematic approach, but how do we
Mm-hmm.
approach patients like this for them to begin their healing journey?
Almost how that process looks.
Yeah.
Yeah.
Yeah, that's a great question. So me personally, I just want to make sure that I'm getting to know my client just for who they are. And I think one of the biggest things, to toot my own horn for a second, I think one of the biggest things that I do bring to my sessions is just the very relaxed and calm, like, be whoever you are in these four walls, because I'm going to be here anyway. I'm not going to judge you. I'm not going to leave you. I'm more often than not just as goofy to like make sure that my clients feel comfortable. I'm a dork. I'm a huge dork. And especially when I'm in session, like I just try to use a little bit of humor and like just being a person to have my clients feel a little bit more comfortable. Um, and it all just depends on what sort of timeline in somebody's eating disorder struggle they're coming to me. So sometimes they're coming in the very beginning and they're like, I don't know anything. I don't know anything about an eating disorder. And helping them connect those dots of, oh, restriction makes me feel in control. Okay, what am I trying to be in control of? And sort of go that way. So sometimes it's really behavior based on trying to reduce the symptoms, because a lot of the time too, like those symptoms and symptom interfering behavior is going to push how long they're in recovery for. um, and then sometimes people come to me and they're like, yeah, I know why I do this and I want to, and I'm done, like I'm done doing it. So that could mean maybe going the trauma route, and sort of having them also develop some type of routine. I like to loop in dietitians. I like to loop in like PCPs and also psychiatrists. Eating disorders are a very big like team approach, but it all just depends on what somebody might be struggling with and also what they feel comfortable working on. Because I'm not going to fix, like, nobody's going to fix anything. I don't love to use the word fix, but this isn't going to go away unless the person is ready to let go. So I kind of try to ask a little bit of, what do you feel comfortable working on? Because me, I'm supposed to push you, but I can't push too much because then they're just going to shut down. So I really try to use a very much like person to person approach, and then also really integrative of where that person might be at. Because sometimes they can acknowledge like, oh, an eating disorder isn't really helping me reach my like goal of life. Like I don't want to have an eating disorder my whole life, but it kind of feels comfortable right now. So we have to look at it too, that you can't just tell somebody that their eating disorder is wrong because we're pulling away their main source of coping. If we pull it away and don't like kind of swiftly start to replace it with things, we're stripping them of how they've survived.
Okay. Stephanie, I'm curious like what the process looks like in somebody that is successfully going through therapy. So is there like certain benchmark that you aim for? For example, client comes in, the first thing we have to do is have them realize that they have a problem.
Mm-hmm.
And step two would be for them, if they have an eating disorder, for example, maybe step two would be for them to develop a new relationship with food. And step three, less of the less of like the vomiting, or less of the binge eating. How does that, like a successful 6 months look like, or a year, or doesn't matter what the time frame is. What's like a
Mhm.
good what are good benchmarks that you're looking for, and what is a successful therapy session actually?
Yeah. I really look for consistency with food. So that's eating however many times a day, and that's where I would typically loop in a nutritionist, because everybody's like calorie intake and timing and things like that is all different. But really consistency with food, um, all of the things that they cut out, sort of reintegrating those into their diet. Um, Obviously, unless it's like for allergy purposes or, other like more extreme medical things, but more often than not, people are cutting out carbs because carbs make you fat, or sugar makes you fat, or something makes you gain weight. So it's reintegrating some of those foods, and also having a really balanced diet. Like, we want people to have a good relationship with food, of course, and not be fearful of foods, or not, want to eat foods for the fear of gaining weight. But we also want to make sure that they're getting their nutrients, because a lot of the times, especially, clearly, if I'm working with somebody who is at a low body weight, like, they're not getting all of their nutrients. Um, if I'm working with somebody who maybe binges, like, you also have to get that routine back of consistently eating, because those binge cycles is just going from like starving to like to full or over full. And having your body learn that, oh, I'm getting food, and I'm getting food consistently, and having them trust themselves, but also their body trusts them that it's going to be fed. So straight up, like strictly food wise, it's really finding that consistency of eating often, and eating until you're full, and identifying what full means for somebody, and having a more balanced diet. Um, I'm really big on like routines with coping tools also, and like looping in that self-care, trying to figure out how do we replace the restriction? How do we replace the purging, the binging, with something that makes more sense? Whether that's meditation, whether that's like calling a friend, whether it's reading a book, like trying to figure out what coping tool is able to kind of ride that urge of wanting to do the thing that we're trying to eliminate.
Okay, and if,
Um,
for example, this is very similar to the last question I asked, but for example, I'm someone that has anxiety or challenging behaviors, and I know I've been struggling with it, but I don't want to see a therapist yet. I want to try to do it myself. So if I suffer for anxiety or these bad behaviors, like for example, I don't know, maybe you're just a really violent person or something, what are some steps or what's a process I could do for myself alone that maybe help me overcome these anxieties or challenging behaviors?
mhm. So understanding where a lot of them come from. So our anxieties don't just pop out of nowhere. Like, that fear is based in something. So maybe asking the questions of, okay, what purpose does this serve? What's this anxiety trying to tell me? Anxiety can also be sort of like a survival response too, like that fight or flight response, that fight, flight, freeze. Like, there's something that's going on that's making you have that reaction. So being curious as, okay, why am I having this reaction? What could I possibly be worried about? Or like what, and may potentially being able to link to something else. And that could be a little bit harder to do on your own. But thought reframing is something that I teach clients in the very beginning. And just, my typical question is, what would you say to somebody else? So that's something that like you can do on your own. Like, oh, I'm telling myself, like, I was anxious before we logged on for this, and I was like, oh my God, you're going to mess it up. Oh my God, you're going to sound stupid. Taking the time for me to sit there and be like, okay, would I tell somebody else that they would sound stupid? Like, no. And trying to reframe your thought in that perspective. Finding the things that you love to do and that make you feel good. That's coping tools. Coping tools can be very simple. I like to go for a run. I like to talk to my friend. I like to read a book. And a lot of the time, we especially with like the go of school or work or whatever, we lose that time for ourselves. So really making sure that we're getting that time, we're carving out that time for ourselves and doing the things that we love that allow our bodies to relax, that allow our minds to relax. So it's piecing together where my thoughts are coming from, what's going to make me feel better, and also knowing when to reach out for help, because sometimes we can try to do that process on our own, and a lot of people do. I mean, it's why we have books, it's why we have podcasts, and it's why we have a lot of other resources. But at the end of the day, if we can't do it all by ourselves, it's also being able to kind of have that conversation with yourself of, okay, I've been trying to do this for X amount of months, like something's not really working. Maybe now it's time for me to seek out help.
Yeah,
And
I know. One more thing, so I don't forget.
I was just gonna piggyback, but go ahead.
I was a piggyback too. I get piggyback. Yeah. One thing that I feel like people don't realize and they kind of underestimate is how much time this is actually going to take to actually change. Because if you're going through this same thought process for the last 8 years of your life, a 1 month therapy session is probably not going to fix that, because you've been thinking and doing these things for the last 8 years of your life. Those are almost engraved in you. That's just like how you are a person now. And you have to change what kind of person you are to not think those same thoughts and not act in those same ways. It's a big time commitment, but remember that you live a long life, and 8 years of negative thinking seems like a lot, but why don't you put in the hard work for a year and have the next 20, 30, 40 years of your life be all positive thinking. You got to put in the time, you got to devote it, and you got to understand that, hey, I'm a person. Maybe I sucked as a person these last 8 years, but it's not the person that I am moving forward. It's going to take some time to change myself as a person, but I'm not this person forever. And I have the power to change the way I think. I have the power to change the way I act. Except I have to put in this process. I have to commit to myself that I'm going to start changing things. And you got to put in the time, put in the effort, and you eventually change it as a person over time.
Yeah. Yeah. A lot of what I think about is like exactly what you said about like the 8 years. Like it's a scale. Like if you're doing this for this long, isn't this side going to be heavier than this side? So we have to kind of balance those things out. And one thing to look at too, I come from a trauma informed practice, which basically means like we want to look at what happened to you, not what's wrong with you. Because a lot of people do have that feeling of, oh, there's something wrong with me. You most likely do the thing that you do because of something. Like this was your reaction to this thing that basically got, like you said, embedded. I explain neural pathways of like roads, of like if you're continuously going down the same road of I'm a bad person, I'm a bad person, I'm a bad person, it's going to stick. So we have to find the thing that's going to help kind of pave that road, but also pave a better one.
I wish
so
there was,
that time is huge.
I wish there was like some therapy. Maybe in the future it'll be a pill where you take, and all of a sudden all the neurons that wired together are all free, and you could just create your own synaptic connections again. And piggybacking off your right, to be determined, right? And then piggybacking off what you guys were talking about on how to cope with this, and you were mentioning anxiety. It's really hard to realize the stories that you're telling yourself and the thoughts that you have when you're just like very mind focused. So also. People listening is drop into your body and tune into your breath and take these nice mindfulness is a great practice for this to see how is my breath, if it's rigid, if it's shallow, if your muscles are tense, why, right? And we have to ask ourselves, why am I feeling this way in this situation? What can I give myself that maybe I'm needing? You mentioned anxiety. It's the fear of uncertainty. What's ahead? Can you give yourself physical safety right now that everything's okay, where maybe that anxiety will kind of go away? So just asking yourself those hard questions of, why is my body tense right now? What is my mind telling me? And can I tell a different story about this reality that's just, it's not reality. It's not fixed. It's only an aspect of reality that you're telling. And then maybe there's more here that we could understand and tell a different story.
Yeah, that's a really good point, because like even the thoughts that go through your head, not every thought that goes to your head should be valued the same. You shouldn't act on every thought that you have in your head. Otherwise, you'd be a mess. You'd probably be a depressed person for sure, because a lot of my thoughts are more negative than positive. It's just what it is. It's just you have to learn to put value in those thoughts that you actually value in a sense, because you just have so much thoughts going everywhere about everything, especially when you're an anxious person. There's so much thoughts going through your head, but what thoughts actually mean something to you? Because not every thought can mean the same, right? And that makes sense. I keep saying thought, and I keep thinking of like thought.
Yeah.
I'm
And then it starts
laughing in
to
my head. I'm
sound
sorry. I'm
funny.
laughing in my head.
The more times you say it, it doesn't sound like a real word.
Yeah.
Like a lot of the times I like tease, like my teenagers, I love teasing my teenagers because like it just like I poke around with them a little bit and I end up joking around of like, why do you, if you're going to tell yourself that you're a piece of shit person every day, aren't you going to feel like a piece of shit person? And I try to make it, I know that it's clearly not that simple, but sometimes it has to be that simple. Sometimes it has to just be, oh, okay, what if I just start to think a little bit of maybe this is going to work out? I don't tell my clients to go automatically from like positive to like negative to positive, because we're never going to believe that positive side. Like go, especially jumping so quickly. Of course, it's going to feel false. So I try to get them to just sit a little bit in that middle, sit a little bit in the gray of maybe this is going to work out. I don't like myself right now, but maybe I'll like myself in a day, in 2 days. I'm working on this thing right now. I have to give it time. Like trying to sit in that gray a little bit, because I get it. We're not going to just automatically believe the positive. But what's the point of telling yourself that you suck every day? Like the world throws things at us, life throws things at us already. And that's what I tell them too. Like we don't know what's going to happen. So something shitty could be happening in a month from now. Do we want to keep feeling like crap because we're telling ourselves that we're crappy? Or do we try to be a little bit more gentle on ourselves, have a little bit more of that compassion? Because like you said, like figuring out what thoughts are of more value. If we can see the beauty in our friends and our family and other people, if we're telling them, wow, you're a really great friend, you're a really great mom, like why can't we tell ourselves that we're great?
Yeah,
So
very good point there, because all that is data. If you think about it,
mhm,
so you telling yourself negative stories, data, you hearing that you're a great person from your family's data too. Now the question
right.
is what data are you going to focus on? That data, the thought that you're saying I'm not good enough is just one data point, unnecessary. We could just void that and focus on something
Mhm,
that's more positive. If and
yeah.
that could be anybody that's in their day to day. What are
Mhm,
if the thoughts aren't adding value to my life, aren't making me feel good, then maybe they're from somewhere stemming down from some insecurity, low self-worth that shouldn't be there to begin with, and we could just dismiss them to focus on a data that's actually going to align, like you said, with our
mhm.
client's goal or make you feel better wherever you're going in life.
Yeah, I tell my clients to ask themselves, and I do this for myself, but have them ask themselves, what evidence do I have that makes this thought true? Where is this evidence coming from? And have them do that on both sides, because the negative for them has some type of evidence. Oh, well, I'm stupid because I got a 60 on my math test. Okay, well, can you name me all of the ways that you're smart too? Because I'm sure there's a lot more evidence as to how smart you are rather than how stupid you are because you got a 60 on a math test. And I have them ask themselves the question too of, is this a reliable source of information? Because sometimes our negative thoughts are coming from bullies, are coming from people that we don't want in our lives anymore or haven't treated us well. I'm thinking about, even people who go through traumatic events. Like if somebody was assaulted or abused, they're taking then, like that becomes their narrative. The person who was the abuser is not a good source of information. They're not a reliable source of information. So trying to get themselves to question too, where was this coming from? Because should we listen to the bully? Should we listen to the person that teased us, all throughout grade school? Or do we listen to our friends and our family and our classmates who love us and and our teammates or our colleagues? So trying to get that question too of like, is this a reliable source of information? Has them question a little bit of like, oh, okay, who should I be listening to? Or how do I listen to myself also? Because we're a reliable source on on ourselves. We sometimes don't think that we are, but we're not going to, like, nobody is going to know us better than we know ourselves, especially if we take the time to do that introspection. And like what you were saying before, of like just sitting with yourself a little bit and being more aware of what's going on.
And Stephanie, how does debilitating anxiety look like? Because we all need a healthy amount of anxiety, right? We need some kind of anxiety in our life to have us be prepared. It's healthy to be anxious sometimes. For example, when I go to work, I'm dealing with people in ICU. I'm anxious that somebody might die. And I need that anxiety because that keeps me more alert, more focused on what's going on. But how does somebody look like that's actually suffering through this high anxiety state? And also, like, for example, depression. People tell me, oh, I'm depressed. It's just like, no, not necessarily depressed. You're just sad sometimes. And we're just naturally sad sometimes. You're just saying you're depressed because you just have a sad day. You're not necessarily diagnosed with depression. You got to hop on any kind of SSRIs. You're just having a rough day or a rough week. It'll pass. You can't have good days without bad days. So how does somebody with actually debilitating anxiety look like and present?
Yeah. I think the biggest thing for me is always like, how much is this interfering with your life? Because even the depression thing is huge. Like, oh, I'm depressed. Like you said, it's like, today you were just sad. You had a little bit more of a sad day. But if somebody is staying in bed for several days, if somebody is getting, their hygiene is completely out the window, if they're missing work, that would be something that we would look at more of, oh, this person might be stepping into the realm of depression. Anxiety is similar in that way too, of how much is this interfering? Are you not able to do your job because you were actually so anxious that, I mean, especially for you guys, are you so anxious that you are going to kill somebody? Is that thought constant of, I can't do this because I'm doing it wrong. I can't do this because I'm doing it wrong. Is how present is that in your everyday? And are you able to reframe it at all? Is there any movement, or is it just still kind of stuck there? So I usually like to ask the questions of, okay, how is it social anxiety? Are we not able to like go out with our friends like we used to because now we're sitting just thinking, I'm this, I'm this, I'm this, I'm this, I'm this, I'm this, and we're so out of the moment because we're only in our heads. And just really like physically what that looks like for them too, that like really helping them identify like the heart racing, this like the stomach in knots, whether you're sweating, whether you're like cold all the time. Like everybody's kind of anxious symptoms are all different too, but I really like to ask that, how much is this interfering? And if the thoughts are the only thing that you really can think about, and like you're just this big ball of like tense shoulders and gut wrenching feeling the entire day, and there's no resolving, there's not even a little bit of a reduction, that to me would be like, okay, we have to figure out what's going on, what we can do, because it is really impacting that person going to work, going to school, being able to be themselves, even if they like in their home, we're thinking like, oh, their home is a safe place. If they're not able to be themselves in their safe place because they're just so in their head all the time, that's something that I would then start to question of like, okay, let's try to figure out how we move away from this. And I know that's kind of what happened to me when I was like a little while ago, a few years back, when I was so anxious. It was like everything that I did was wrong, or everything that I did was going to end up poorly. And it was the only thing that I was thinking about was, I can't do anything because everything's going to be wrong. And I can't deal with the wrong, if that makes sense.
Yeah, that does make sense.
And I feel like it also makes healing a lot harder when we always label things, where we label that I'm anxious, I have anxiety, and that label almost attaches that to your personality, and you can't change it because it's part of like who you are. A perfect example is patients that come in and they're diabetic. Okay, you're diabetic. I understand that there's a genetic component, but have you tried lifestyle changes to reverse that? Did you know that's reversible? Or did you just say, I am diabetic and that's it? You lived with that label and you haven't taken any action to change that.
Or doctor told me I'm diabetic, so I'm diabetic.
And that's your label. And I feel like sometimes people with like, I don't want to talk about anybody's mental health in the wrong way, but labeling anxiety or depression, you just say you're depressed and that's it. That's just how I've been. I've done it for 15 years. And it's very disempowering when I hear patients speak like that, because we all can take accountability for the way we're feeling and change that in a sense. And that's also what's interesting about psychology and the DSM-5 and how we label things, again, because we put labels onto people, right? You have ADHD, boom, we slap that label. But what we're experiencing are just symptoms that the body is producing. That's ADHD. We're not getting to the root cause that the DSM-5 is doing. What if it's childhood trauma that has the same symptoms of ADHD, and we're just putting a label on ADHD and just calling it that and rolling with it? So
Yeah.
it's we need some mindset shifts when it comes to that area of life. So
It's like a cop out almost.
Definitely.
It's almost like an easier way just for us to be okay with what's happening in a sense.
Yeah. And this is, and
Yeah.
last thing, this is not only psychology, it's also in healthcare. We're labeling and putting labels, and we're creating lifelong customers with
Yeah.
pharmaceuticals and patients versus doing the healing, both physical and both mental.
Totally. Well, that's where my head was going, was a lot of this is the system. So even with the DSM-5, a lot of places, like I'm thinking about treatment centers. So when I worked in the residential treatment center, we had insurance calls every week for the clients. And we had to run down a list of reasons as to why they needed this level of care and not a lower level of care. And they're just checking off boxes. So it is a system kind of problem, because if you don't have this problem, then you can't receive this type of care. So I think a lot of the times my approach is like, I need to know, like, I need to know the symptoms, because I need to know kind of, where to go. But I'm not sitting there being like, okay, you binge XYZ times a week, so here's your diagnosis. I'm like, oh, you binge XYZ times a week. Okay, why? What happened on that day? How do we move in there? And kind of asking those questions. But from a system perspective, like, the insurance companies need those answers to be able to say, okay, this person deserves to be. Sometimes it is a deserving thing, unfortunately, because one different kind of number, one different statistic, they're kind of pushing people to a lower level of care when they might not be ready. But they're looking at all of these things of like, okay, cool, I'll pay for residential because she's X amount of sick. But I'm not going to pay now. I'm not paying for residential because she's not X amount of sick. So it's kind of like that. And I can see also too why it's hard for people then to separate themselves from those labels, because like you said, oh, well, my doctor called me diabetic, so of course I am. It's like when you're being told that you need to meet certain things to be sick enough for care, it's hard to separate that. But I think, like, yeah, I think we can move away from that. And I think people have started to a little bit. We have, long ways to go with it. But BMI is the biggest thing that I kind of think about too, because BMI is looked at a lot for eating disorders, but also just for healthcare in general. And BMI was made up by an astronomer. BMI wasn't even made up by a doctor. BMI, it literally was an astronomer that made up BMI. I don't know how much more like bullshit that could be in a medical like space. I'm curious though to see if you guys, because I know I know you guys travel. Have you guys come across people with eating disorders in the hospitals?
Not a lot. So we do ICU.
Mm-hmm.
So I want to say, only I saw two eating disorders. One was a girl that was in her early 20s that was just super malnourished, and she had to actually be checked into the ICU because we had to give her TPN.
Mm-hmm.
And another one was an eating disorder, but this was an older person that was just failure to thrive. So that was not necessarily like an eating disorder. We were classifying it as an eating disorder, but it was just a more of
So like
malnutrition.
swallowing glass and stuff. Was it that one?
No, this was
Okay.
back. None of these happened here.
Okay.
This was back in Chicago.
Mm-hmm.
But yeah, I haven't really like only one case in the last
Yeah.
like 5 years I've been because it's ICU. A lot of our patients come in for
Right.
are usually older. It's more of like a respiratory issue or cardiac issue. We don't really see too much
Right.
of that. And if like for example someone with an eating disorder comes in, they're not necessarily coming for the eating disorder. They're coming for the complications like a stroke
Right.
because of the eating disorder or something that happened because of the eating disorder. Yeah. So I
Right.
never treat anybody.
Yeah.
With it. Yeah.
Yeah. Yeah. I want to put this out there too. Like, I appreciate having this conversation with you guys, because I have also seen the way that people have gotten treated by medical professionals and who don't really know a lot about eating disorders. And they're not really taught. When I first started working at the residential facility, and I explained to some of my colleagues that I actually had a class in grad school about eating disorders. It was 6 weeks, it was sort of a half credit class. Everybody else was shocked. All the other like social workers or mental health counselors are like, wait a minute, you learned about these in school? This was like a week, and we got, kind of, we moved on to the next topic. And it's unfortunate because it's not really talked about. And just from like a medical standpoint, I had once actually taken somebody to an ER, and the client at the time was explaining to the ER doctor at the time, of like, I have edema, like, and it's really, bothering me. It was in her legs, and explaining a whole bunch of things. The doctor just dismissed her because she was at a lower BMI. She was somebody who was on the smaller side, and she did have a lot of weight to gain, but they weren't putting the two together, that she actually was experiencing edema from, and that she knew from her past medical history, because they didn't really know about eating disorders, and they didn't really know a lot of like the complications on the medical side. I'm a little bit farther removed from the medical side now because I'm not in the residential setting. But that's something I just, I appreciate having the conversation, just because it's not, I'm sure that they're, granted, maybe not ICU, but I'm sure they're in your hospitals. It's just a matter of like having clinicians, doctors and nurses that know more too.
Yeah, what really blew my mind when you said that someone has to qualify into a certain like DSM-5 thing. It's kind of like mind blowing, because you have to qualify to be diagnosed with like a certain issue, or you have to qualify to be labeled as this, so then you can get this kind of treatment. Is there like any other approach that we could take that doesn't involve having to qualify to get a certain amount of treatment? Should maybe do a approach that's more of like, it's to say treatment based instead of like symptom based. So let's just say somebody comes in with like some psych stuff. We first try to talk to them, then we try this, then we try that, instead of like having to first label them with some kind of a disease or issue before they could start treatment.
I wish, I wish that I could like snap my fingers. Yeah. And like have a facility pop up tomorrow that's like, okay, everybody with this, like behavior, this, like, history, whatever, all kind of come into a room. It really is, as far as I know in this moment, there's not really many places, that would be able to be funded in that way, unless it was sort of like privately funded, and treatment costs a lot of money. So that's kind of the thing that I wish that it wasn't like that. I think there would be, a lot of factors, a lot of barriers to be able to have more of just a person approach, and not you knock all of these lists. So listen, it's treatment centers are a business. We can't knock them. Like, they have to be a business. They have to somehow make money to run, and to have the resources. But unfortunately, it does end up being a little bit on the business side when you're working with insurance companies, and that you have to sit there and say, this person, you want the person to get better, but then as soon as they get better, they get kicked out, and they might not be ready for that lower level of care. They might not be ready for a PHP. So I wish it was simple to just say, like, we're going to treat you as the person that you are, and really try to understand, again, that purpose of what these things are doing for you. I think we're a little bit of ways away from that,
Yeah.
unfortunately.
And I think
But
that's very important for everybody to just take accountability for their own health in every single level, because we have a system that's disadvantageous. Pronouncing right.
This.
Yeah, not today, man. I'll continue.
yeah, I'd butcher it too. Yeah,
Okay.
no, I'd butcher it too.
So the system is not of benefit to us, just like pharmaceuticals and pills for cholesterol, any little thing, diabetes. We have to really take a hold of our health and actually see what the treatments are, maybe what the root causes are, how maybe we should proceed, and then use that judgment from in this case, Dr. Google, compare it to a
Yeah.
specialist and see maybe how
Yeah.
you can go about things, not in an ignorant way, but just in an informed way,
Yeah.
because of the way
Yeah.
the system is.
Yeah, it's interesting
Yeah.
because it's like almost like they took the physical model of treating physical issues and just threw it at the mental aspect. Because there's a big difference between physical and mental, right? For example, physical as in you have a broken bone. Okay, I guess physically see the bone being broken, I gotta put that
Mhm.
bone together. Or physical in a sense of diabetes. Okay, pancreas doesn't produce diabetes. Okay, we get insulin into the system. In the mental approach of things, it's different because you don't see that. You don't see a broken brain, right? You don't see you're depressed because you have the parietal lobe of your brain is broken, and once you attach the parietal lobe together, your depression goes away. It's not physical. It doesn't. You don't see it physically being fixed. It's more about how you feel, and just taking that approach of trying to physically fix the mind in the same way you physically fix things in your body, it just doesn't work. It's just a
Mhm.
simple way we do things, and we have to kind of figure out a different way how to treat the mind, because it's not a physical fix. It's an internal fix that you can't see. Only that person that's experienced that could feel that fix,
Mhm.
and we gotta
That's
figure
one
out
of
a
the
way.
things that, yeah, that's one of the things that I love. It's also one of the reasons that I started to work with kids, because when I was in grad school, I was like, I'm working with 18 and older. That was my thing. I was like, I need to talk to adults, because I at the time was just like so set on, this is the way that I know how to explain things. So like I need adults. But as I've been in this field and have started to see a few more things and just put more pieces together, it's why I kind of started to lower the ages that I started to work with, because I was like, wait a minute, okay, if we can help somebody who's 6 or 7 start to understand their feelings, start to understand, oh, when I clench my fists and I get really hot and I want to hit something, that means I'm angry. Like, we can set up this generation for something so much better than our generation, like generations before them have had. So that's one thing that I'm grateful for, in kind of the shift of what parents now start to see. And parents now like are asking those questions and are having their kids come into therapy, and there's starting to be less of a stigma about therapy overall, and like you don't you're not like fucked up then you need to go to therapy, right? Excuse my language, but like me, like I see kids, my colleague Lauren sees kids, our newest therapist to Peaceful Living, Kate, also sees kids. And I think it's really great because some are coming in because maybe something did happen, their parents got divorced, and like that's really big for a kid. And sometimes I've had parents just kind of say like, listen, I just want to make sure that my kid knows that they can talk to somebody, and I want to make sure that my kid knows like that their feelings are okay. And sometimes, and like I am very grateful, I work with really wonderful parents, and they ask for tips on how to model things on a daily basis, because I'm only getting them once a week. But that's something that I'm grateful for, because I think that we are then able to put together, your body is reacting in a certain way, and it's coming out maybe in a more mental way. So how do we put those together, and how do we move forward so that maybe a kid who has the tendency to like hit their sibling when they're frustrated is actually able to say like, oh, I'm frustrated right now. And it depends on language for however old the kid might be. But these kids also nowadays are amazing. They're coming into my office being like, well, I don't like this thing, and that, like, my brother did this, and that's why I got really mad, so that's why I hit him. I know I'm not really supposed to. I know I should count to 10 and take a breath. And I'm like, what are you talking? Like, they're learning a lot more, which I'm grateful for. I didn't get taught that when I was in school. Nobody told that I can stand on a soapbox about what should be involved in school curriculums, but I'm happy to see that there is that shift. Um, but I think that there's a lot of things like that. Even you guys mentioning diabetes, mentioning heart disease. I think if we start to really be able to explain things a lot sooner, like a lot of you always need something to happen to get treatment, rather than it being prevented. And unless you get a really great doctor, that sees your family history and is like, okay, let's have that not happen to you. A lot of the times it's oh, something happened, so now let's figure it out, let's fix it, rather than, kind of going from the beginning. But I think that's awareness and, these types of conversations and getting that information out to people of like, it doesn't have to be like this. It doesn't, like, we can hopefully change the system at some point, that you don't need to be super sick in order to, check all these boxes and be super sick to get help.
Yeah, I'm glad to see that the awareness for mental health is uptrending,
Hmm.
because there's this, like you mentioned, there's this stigma that when people go to therapy, it's because they have some crazy mental issue like bipolar or schizophrenia. When you hear somebody go, like if I tell my parents, hey, Matt's seeing therapy, they're gonna be like, oh, what happened? Is he going crazy? I think
Yeah.
people are slowly
Yeah.
shifting from that mindset and into younger generation where seeing a therapist, getting mental help is seen more as a way for you to improve yourself.
Yeah.
More of that approach. Not that you have a problem, it's just you're trying to make yourself better than you are. And sometimes one way to do
Yeah.
that is, if you can't do it yourself, is through therapy. And that's completely okay. It doesn't mean you have a disease. It doesn't mean you have an issue. You're going to therapy because you want to just make yourself a better person in general.
Yeah.
I think that's the
Yeah.
way therapy is going, and that's the proper way to look at therapy. You're just trying to make yourself
Yeah.
mentally better. Same way you go to the gym to make yourself physically stronger, and you can't get the same results as working out at home. For example, if you try just to do body weights, work out at home, push-ups, pull-ups, you're gonna get stronger. But once you throw in weights, go to gym, you're gonna get even more stronger. Same with therapy. There's only
Right.
so much soul searching you could do until you actually need some help to even get greater soul searching.
Yeah. Yeah. And I'm really grateful just for the conversations that I've been able to have, like with other colleagues too, and like in the field as a whole, and wanting to get more of that awareness out there and wanting to help with that stigma. Because even when I started therapy in high school, I didn't tell anybody. My parents knew, and my cousin knew because I didn't drive at the time, so she would drive me to my therapy sessions. But like, I didn't tell anybody, and I didn't necessarily understand until I got older that, like, oh, I didn't tell anybody because I thought that there was a problem with going. Like, and almost kind of fed into that stigma at the time. And now, like, I'm happy to even hear some of my clients be like, oh yeah, like all my friends know who you are. My friends know I'm in therapy. And I'm like, oh, beautiful, because none of my friends did 10 years ago, 15 years ago. So, I'm happy that it is starting to change. And I'm happy that people are starting to just take care of themselves a little bit better, and wanting to, like, live the life that they really want for themselves. And that's just kind of what the little nuggets that I drop in session, like, that's just kind of what I'm hoping is helping people do, is just like live the life that they actually want to live, and not feel trapped by their thoughts and their feelings, because you don't have to be. Our feelings are just trying to tell us something. They're just signals that, like, something needs a little bit of attention at the time. They're not scary. They're not gonna hurt you. They're gonna go away. It's like, I on repeat a little bit, because a lot of my clients, like, they don't want to feel because they think that their feelings are never gonna go away. And it's like, they do. They do. They just need a little bit of attention in that moment.
That's powerful. And it's awesome that you're also giving positive encouragement to these patients that they could see the other side of healing and how that looks. One last question I would like to ask all of our guests. So, if you had the
Yeah.
opportunity to have a cup of coffee one last time, who would it be and why?
I love that. My grandparents. So I don't have any grandparents anymore. I had three growing up. I had my maternal, like, both sets of, like, my grandpa and my grandma, and then my paternal grandma. And a little while ago, my colleagues and I were having the conversation of, like, did you ask your grandparents questions? Like, do you know the stories? Like, do you know them as a person and not just as your grandparent? And I really didn't ask the questions. And my grandparents, like, I'm first generation born here, so my grandparents came over from Italy with my parents, and they spoke Italian. And I learned it. I lost it a little bit as I got older, but that language barrier was really hard for me to sit there and ask all of those questions. So now that I'm a little older and a little wiser, it's like I, want to be able to, like, sit down with them and ask those questions, and just get to know them and also just have them see, all of the things that I've done since they've been gone. But yeah, those guys.
And Stephanie, where can people find you if they want to reach out to you?
So I am at Peaceful Living Mental Health Counseling in Scarsdale. So you can look us up on Google. I have an Instagram that's professionally geared. I don't post on it too much, but it's Stephanie, STEPHANIE, Polizzi, POLIZZI _ Oh God, now I think I'm going to tell you it wrong. It's really long, as you can see. I think I'm going to tell you it wrong now. Yep. So Stephanie Polizzi _ LMHC for licensed mental health counselor. And that's my Instagram handle, but Peaceful Living has an Instagram also.
Okay. Amazing. Thank you for your time, for being on the show. We just want to acknowledge you for your knowledge that you brought to us about therapy, about EMDR, which I had no idea about. We just learned our first time. And thank you for what you do for the youngins, the teenagers, and helping them move through their eating disorders and everything else that you might deal with in your office regarding trauma. So thank you.
Yeah. Thank you guys. Thank you for inviting me. Thank you for doing this. I've listened to a lot of your episodes, and the conversations that you guys have is just wonderful. So keep doing what you're doing. It's needed. So thank you so much.